innovations often fail many times before they succeed. But how many times is enough? The first recipients of the Jarvik 7 artificial heart, a pivotal moment in medical history that illustrated the delicate balance between innovation and patient welfare, raising ethical issues in the pursuit of advancing medical technology. Barney Clark, 57, was the first recipient of the artificial heart transplant. He smoked his entire life and was diagnosed in 1978 with emphysema, congestive heart failure, and cardiomyopathy. 57 being considered too old for heart transplantations made him ineligible for the surgery. At the same time, a team of medical professionals were finding a candidate to receive the very first artificial heart named Jarvik 7. He was interviewed by the IRB about his decision, and a team of physicians even tried testing his determination by urging him to reconsider, but he remained steadfast. Dr. William Davridge led the surgery on 1st December 1982. Clark experienced delirium, confusion and memory loss, sometimes fell unconscious, and had seizures. After the surgery, he was very depressed. I don't think he was going to be alive.
This is the boldest experiment ever attempted.
The experiment more than failed.
It was just too expensive. Without it, he would have been dead by midnight.
Yet there were 3 more attempts with the Jarvik 7. The first survived for 21 months, second for 10 months and 2 days, and the last person survived only 10 days.
So Barney Clark was the first recipient of the artificial heart, and he experienced significant complications post-operation, including confusion, delirium, memory loss, semi-consciousness, and seizures. Of the 3 subsequent patients using the Jarvik 7, the first survived 21 months, and the second 10 months, and the third only 10 days. So Davridge, who oversees these medical devices, admitted that the surgery likely shortened the patient's life, going against the ethical principle of non-maleficence, which means do not cause harm. And in our view, it would be unethical to continue using this device as the risks currently outweigh the benefits, and this machine doesn't show significant benefits for the patients, with only a small, uncertain chance of extended life. The Jarvik 7 shows a lack of efficacy, causing patient suffering, and the continuous use would thus violate this ethical principle of non-maleficence.
So are these few extended months worth the severe side effects? Is it ethical to test this machine on patients near death? These devices created may be exploiting patients' final moments, which causes undue suffering. The FDA withdrawal of approval for the Jarvik 7 as a permanent device highlights the ethical concerns about its use, which emphasizes the need to protect patient safety. Continuing to develop a device with poor outcomes diverts resources from more effective treatments. Thus, it is unethical to use the Jarvik 7 in its current form, and efforts should focus on improving the technology and ensuring future trials prioritize the patient safety and informed consent.
In my opinion, I don't think it is ethical to offer Mr. Clark an intervention and then subsequently persuade him not to accept it, because patients have the right to make informed decisions about their own healthcare. This includes being fully informed about the potential benefits and risks of an intervention and making their own decision without any undue influence. Persuading a patient undermines their autonomy and compromises the integrity of the informed consent. As healthcare providers, we should act in the patient's best interest and avoid causing harm. If an intervention has the potential to extend a patient's life, discouraging its use could be seen as acting contrary to the patient's best interest and potentially causing harm by withholding a beneficial treatment. Our relationship with the patient is built on trust, so patients need to trust that we are giving them unbiased and accurate information and acting in their best interests. Persuading a patient can erode this trust and damage the therapeutic relationship. Additionally, we need to treat patients fairly and equally. Offering an intervention and then persuading a patient not to accept it may create an unjust situation where the patient is not given a fair opportunity to benefit from the intervention. Furthermore, clinical trials rely on the collection of unbiased data to determine the efficacy and safety of interventions. Lastly, ethical communication with patients requires transparency and honesty about their options. Offering an intervention and then subsequently persuading them not to accept it can be seen as deceptive, compromising the ethical obligation to provide clear and truthful information. So in conclusion, any form of persuasion or coercion of the patient interferes with the patient's rights of making a well-informed and unbiased decision. Healthcare professionals should not impose their own beliefs or decisions or in any way persuade the patient to make a decision that is not decided by the patient themselves. The patient should have the right to either agree or disagree with the participation of the study and to make an informed decision about their health.
So today we'll be doing the informed consent process with you, and Angeline will be acting as your witness for this process. So the reason we are doing this is to ensure that you are aware of the procedure, the purpose of the trial, the duration and risks and benefits of this trial. We will go through with you every single page of this informed consent form to make sure that you understand what you're up for. And at any point of time, you can ask any questions and we'll answer it. Is that alright?
Yeah.
Okay, since you're not eligible for the normal heart transplant, right, the new procedure is a viable option for you. This procedure involves implanting an artificial heart into you so that it can help you pump blood throughout the body for you. It is important for you to know that you will be the first patient to be receiving this procedure. So the procedure itself will take about 6 hours with no expected issues. And now Angeline will be explaining to you the risks and benefits of this trial.
First, I'll go through the possible benefits if you participate in this trial. By participating in the clinical trial, you will help provide us with critical data that helps researchers understand how the Jarvik 7 implants perform in real conditions, especially to determine the safety and effectiveness of the artificial heart. Furthermore, data retrieved from your participation will lead to the refinement of surgical techniques, post-operative care, ultimately improving outcomes for future patients. Secondly, this device might have the potential to extend your life expectancy or elevate your symptoms. If successful, this life-saving intervention might extend your life expectancy, as you already unfortunately have limited time due to your severe cardiac conditions. The device may also possibly elevate severe symptoms of heart failure such as shortness of breath, extreme fatigue and swelling, allowing you to feel more comfortable and engage in daily activities. Lastly, you will receive the highest level of care when you receive close monitoring and comprehensive care from a team of medical professionals, which means that any complications or even health issues can be detected and addressed promptly. Additionally, you have access to all medications and state-of-the-art medical technology as long as they are relevant in treating the trial-related injuries. This provides opportunities for improved health outcomes. However, like all trials, there are also risks associated with this surgery. I will now be explaining the possible risks if you partake in this trial. First, given the experimental nature of the Jarvik 7, there is no guarantee that your quality of life will improve. You will most likely face significant lifestyle adjustments due to the extended recovery periods and a heavy dependence on the external power source. You need to be diligent in maintaining and managing the power source to ensure continuous function of the device. As it is also a surgery, there are inherent risks and complications such as infection at the surgical site, excessive bleeding, possible adverse reactions to anesthesia, and damage to surrounding tissues and organs. There is also a risk of post-operative complications. The presence of a foreign device in the heart can increase the risk of blood clots, which can lead to strokes or other serious complications. Apart from this, there is also a risk of mechanical failure, which can be life-threatening. It is a new technology, hence the device performance and reliability are not fully known. You and your caregiver thus need to be prepared for potential emergencies related to the artificial heart, such as device malfunction or power failure. This includes having a plan in place for seeking immediate medical assistance and understanding how to manage the device in critical situations. Do you have any questions?
No.
Okay, so we have gone through everything in the informed consent form. So now we just need a signature.
Okay.
Here's a copy of the informed consent form for you.
Okay, thank you.
As we've seen, the use of the Jarvik 7 has sparked ethical debates about the effectiveness of the device, problems revolving around patient safety, and medical motivations. From what the medical professionals have shared, here are some of our key takeaways. While it is reasonable to expect some failures with new medical interventions, the conclusion drawn is that the survival times and outcomes associated with the Jarvik 7 artificial heart do not justify its continued use. The limited success and significant risks observed in patients suggest that the device's potential benefits do not outweigh the harms. Continuing to use a device would thus be unethical and fail to prioritize patient welfare. It is unethical for healthcare providers to offer a potentially life-extending intervention and then persuade patients not to accept it, as this undermines patient autonomy and informed consent. Doing so also contradicts the principles of beneficence and non-maleficence, potentially causing harm by withholding beneficial treatment. Such actions can cause unjust situations and thereby erode trust between patients and healthcare providers. Ethical medical practice thus requires transparent, unbiased communication and respect for patient autonomy to ensure patients make informed decisions about their healthcare. With regards to informed consent, beforehand, the patient's capacity to make decisions should be assessed. If patients lack mental capacity to give valid consent, then consent should be obtained from patient's legal representative. During the process, informed consent for those with terminal illnesses must be comprehensive and realistic. Patients should be fully informed of the nature, duration, purpose, benefits, and risk, including inconveniences and effects upon their health. This is to ensure patients make a well-informed decision. It is also good practice to ensure language used during the informed consent process is kept simple, straightforward, and of no jargon. Concluding on the crucial information for explaining the risks and benefits of an artificial heart implant, benefits include the contribution to medical knowledge and advancements, extended survival potential, and access to comprehensive medical care. However, patients must also be aware of significant risks, including the possibility of no improvement in quality of life, surgical and post-surgical complications. Ensuring that patients understand both the potential benefits and risk allows for informed consent and realistic expectations about the outcomes of the procedure.